So this is just a short little film to talk through choosing and setting up a Zimmer frame should you find yourself in a situation maybe at the weekend where a patient's been admitted, they've told you that they normally use a Zimmer frame at home, but they haven't brought theirs in with them. So how do you set it up and choose the right frame? First thing you might say to the patient, or their relatives at least, is could they bring their Zimmer frame in with them? Because hopefully that frame has already been set up for them in terms of height, etc. However, if that's not the case, and you really feel you need to go and get one from the store, then this is how you might set one up. So a Zimmer frame is a walking aid, obviously. The first thing you need to check with the Zimmer frame when you take it out of the store is that it's safe to use. What I mean by that is that, say, the ferrules, the rubber stoppers at the back, are not worn down, that there's no metal showing, that the wheels themselves move, they're not stuck, and that it feels reasonably solid. Once you've done that, the next key thing is taking the height of the frame. All the frames are adjustable, and they're all adjustable, but you have to adjust all 4 legs of the Zimmer frame by these small metal buttons that you push in, turn, move the frame until you hear them do that double click. So obviously all 4 of the limbs, as it were, the 2 back stoppers and the 2 wheels need to be set at the same height so that when the frame is the right way round, it's not wobbling or unsteady in any way. The next thing you want to do, and why you might want to adjust it in the first place, is getting the correct height. So ideally, you want the frame to be about level with their pelvis. If the arms are hanging, it's about level with what we call the wrist crease, where the handles are. That should give you a pretty good gauge as to being the right size for the patient that you're setting it up. Too low and they'll stoop, too high and the frame will cast their weight backwards, which is not what we want. If you're unsure, make it just a little bit smaller rather than taller, because this throws their weight forward. If they've not used a frame before, so they haven't got one at home and they haven't used one before, but you still feel this is the right piece of equipment for them, just a couple of things about usage. These are maybe very obvious, but they're worthwhile repeating. So let's imagine our patient is sat in the chair and you brought their frame to them. The first thing to just tell them is that the frame isn't a standing aid, it's a walking aid. What I mean by that is that many patients, as soon as you put something in front of them, will try and use it to bring up. But as you can see, there's nothing to pull on. It's not a rotunda or a Sarah Steady. This is not something they can pull themselves up. So we dissuade them from doing that, put their hands on the arms of the chair or on the side of the bed if they're coming off the bed, and they still have to be able to push themselves into standing. Then they can transfer their arms onto or their hands rather, onto the frame. So if the patient can't stand at all, you can just leave them in bed, they're safe, and then let them know on Monday the physiotherapist will be in and can do a full physiotherapy assessment. If they are able to stand and they're pretty steady, they're not really dizzy, they're not feeling lightheaded, then the frame is the walking aid of choice really. The frame itself will just push. Lots of people, because the old-fashioned Zimmer frames where they used to just have 4 legs, think they have to lift them, but the frames will just push. You want it a little way in front of them, and basically the patient wants to end up about level with the back feet of the frame. Many people, when they see this space in the middle of the frame, think that they have to walk into it, but that would just again cast their weight backwards. So the frame goes first, and they end up level with the back feet of the frame as they're walking. As you can hear, this one's rattling a little bit, even though the ferrules are very, very good and totally safe. We do have, and I'm just going to grab another one from over here, some other different kinds of ferrules that are recently on the market that we've started using a lot around the hospice. So you may see them where they have ferrules like this, called ski ferrules. So instead of having that rubber stopper, they've got these ski-shaped attachments that go at the end of the frame. What that allows is for the frame to glide much more easily. So there's less resistance from the floor. If someone's really unsteady, you don't want it running away from them. So you may choose something that actually is a bit more juddery, but feels more secure. But if someone's got a good gait and they've got a good weight at which they walk, this will allow them to walk at a more natural pace. When it comes to sitting down with the frame, the person has maybe walked back to the chair, they've turned around. You'll know these routines of knowing that the chair's there with the backs of their legs. Always get them to release their hands and reach back for the arms of the chair and lower themselves down. The risk of keeping hold of here is it's not safe and they go down with a clatter. So using a frame.